Hey guys, for those of you who don't know me, my name is Kim Narker and I am the founder of the Stretch Method and the founder of the Stretch Mobility Coach. And today I'm going to talk about how to fix spinal stenosis without surgery. First, let's go into what lumbar spinal stenosis is. And it's actually defined as an abnormal narrowing of the spinal chorale or the neural foramen that results in pressure on the spinal cord or the nerve roots. This narrowing actually causes symptoms of pain, numbness, and weakness in the legs. And symptoms are typically gradual in onset and improve when you lean forward and you sit down. It typically occurs with arthritis and degenerative disc disease when those two diagnoses are not controlled and improved with proven techniques that improve joint mobility in lumbar 1 through lumbar 5 vertebrae of the lumbar spine. Now, lumbar spinal stenosis typically occurs for those of you that are over age 50. And people with spinal stenosis report that they have difficulty standing and walking more than 5 minutes. And they also can't stand up tall like they used to. Now, the lumbar spine includes lumbar vertebrae L1 through L5. And this would be L5, this would be L4. And I know a lot of you have heard about L4, L5, but I don't want you to think that L4, L5 is the only area that someone can get spinal stenosis in, or that spinal stenosis is the only thing that is going on when you have pain with standing and walking and you get relief from sitting. So if you have L4 here and L5 here, then in between each of these is a disc that allows cushion in between those two vertebrae. And then there on the back side of there are going to be nerves that go out on each side. And these nerves are really tiny when they come out of L1, 2, 3, 4, and 5. And they exit on the outside of the vertebrae. And when someone is diagnosed with spinal stenosis, the report will show that the space around the nerve is limited, and that limitation is due to osteoarthritis. Now, this arthritis surrounds the nerve and causes the joint not to move correctly. And the body will show signs of this process in ways of muscular atrophy of the deep muscles that surround the lower back. And the level of nerve damage can be shown if you can look at your back or your spouse's back. You're going to see some growth of hair around those areas, as well as maybe an absence of hair. And that's going to tell you how much nerve damage there actually is. Now, when the lower joints, meaning L1, 2, 3, 4, 5, and there's so many more that we look at, but for today's video, I'm just going to talk about the lumbar joints. When they no longer move correctly, they send a message through the nervous system to hold the muscles, and the muscle ends up atrophying, which is dying. They stay in a holding position and they are not active. That doesn't mean that they can't become active. It just means that they're in a state of a holding pattern, and that atrophy you can see by looking at the lower back. You're going to see like an area that is sort of sunken in, and those muscles are no longer supporting the lumbar spine as they should. And these signals from the joint are sent via the nervous system, and they send a response of pain when the body doesn't have the true muscular support that is needed. And this response is sort of a call of help from your body. Arthritis diagnoses, degenerative disc disease diagnoses are going to lead to stenosis if you do not treat them properly. And the lumbar spine is supposed to, if I'm looking at L5 and L4, and then of course there's 3, 2, 1, and then there's the thoracic spine, and below that is the pelvis. But if we look at the sake of this video as these being L5 and L4, All of the lumbar spine and the spine are supposed to bend forward. They're supposed to bend back. They're supposed to side bend, and they're supposed to rotate. Now, when these joints in the lumbar spine are restricted and not moving properly, this increases the rate of arthritis growth and increases the risk of degenerative disc disease and stenosis. So I know you guys have heard some words in here that you don't understand, and that's a joint restriction. So let's talk about what is a joint restriction. Joint restrictions are found in the lumbar spine joints. Now, this is L4 and this is L5. The joint is actually where two moving bones connect. The joints of the spine are labeled by the number of the vertebrae in that area, and each of the vertebrae have nerves, muscles, tendons, ligaments, and other connective tissues. And when the joint is restricted, what that means is the joint is tight. It's not moving the way that it's supposed to because there's something going on. We typically in our clinic refer to that as the joint is locked up or it lacks mobility. The joint structure and the structure become affected, and this dysfunction is often the root cause of so many aches and pains in the musculoskeletal system, and they can cause symptoms of sciatica, muscle spasm, make you feel like my back is giving out, and things like that. And these joint restrictions or the lack of mobility in the joint actually cause other areas of the body to compensate. And this compensation causes an overuse of muscles, tendons, and ligaments and nerves, leading to damage in the musculoskeletal system. The body's response to the restriction initiates a response to the nervous system, and the nervous system plays a crucial role in the proper function of healthy movement. Pain is signaled to let us know that the body can no longer compensate without damage. And addition to pain, numbness, tingling, and an irritated nerve, this signal will actually trigger the body's response, causing muscle tension. It's going to cause muscular tone, muscle weakness, joint instability, poor posture, joint and muscle pain, and there's a lot more that I won't touch on here. So common areas of joint restrictions in the lumbar spine are lumbar 1 through lumbar 5. And if you're experiencing pain with walking, standing, and you're over age 50, chances are you have spinal stenosis. And it doesn't require surgery, guys. Non-surgical, natural treatment is available by a stretch mobility coach. In fact, the faster that you can improve the joint mobility of the lumbar joints into rotation and take the pressure off of the nerves while you work to restabilize deep, supported lumbar muscles, the better the long-term results are going to be. You also need to look at hip mobility and pelvic and core mobility and stability so that you get proper long-term relief from spinal stenosis. Proper exercise prescriptions are required to keep the lumbar stenosis at bay, and you have to rebuild those muscles that have atrophied in order to get long-term relief. Now, other health-related choices such as decreasing your intake of inflammatory foods can also help in the decrease of growth of osteoarthritis that leads to stenosis. Now, I'm not going to go into this in this video, but these unhealthy eating choices can lead to inner body inflammation, which leads to an increased growth of arthritis. Now, another thing that you can request if you have stenosis is deep thermal laser. This deep thermal laser treatment, along with the stretch method, is highly effective in preventing surgery with lumbar stenosis. The lumbar spine sends a message to the hips to tighten. This causes compensation in the low back and pelvis, and this can lead to other problems related to any type of low back pain. So, prevention tips. You need to maintain a normal, healthy joint mobility throughout the body. Now, a lot of you go out and you do mobility drills or things like that, and those things are great, and they are trending right now, and they are a necessary component of maintaining joint mobility. But to be able to improve joint mobility, you are going to have specialized techniques. And those techniques are done every day by stretch mobility coaches. Other prevention is going to be maintain healthy muscle strength and flexibility, eat less foods that cause inflammation, sleep well, work on your cardiovascular system, strengthen your musculoskeletal system, be consistent with mindfulness and relaxation, decrease stress by being authentic, meaning if someone triggers you, tell them immediately what you don't like and say it in a loving, kind way. Deep thermal laser can regenerate and heal the cell around the low back area and will decrease the nerve sensitivity while you regain joint mobility and strength. And that, guys, is the key to taking and improving spinal stenosis naturally so that you do not have to lead and go in the direction of surgery. We at The Stretch Mobility Coach, and you can go to www.thestretchmobilitycoach.com to learn more, but we have helped over 10,000 people with low back pain and stenosis improve their mobility, improve their strength, and go on living, and all without surgery. And we know this because we're tracking our people, and we're also keeping people on for maintenance to make sure that that stenosis is not growing and impeding their joint mobility. Now, proven ways to relieve lumbar stenosis naturally for good is the stretch method. And that method is what I have developed, and it is a proven process that takes a client who is experiencing pain and tightness in the low back, even signs of sciatica, through a successful program that relieves the pain and tightness for good. The stretch method is utilized only by stretch mobility coaches. Now, for most of you, you may not know what a stretch mobility coach is. And a stretch mobility coach is actually a certified practitioner that has gone to school and graduated from an accredited program or is currently licensed as a physical therapist assistant. Those assistants can train to work as a stretch mobility coach, given that they meet the requirements of the stretch method. They are able to utilize the stretch method, and they are able to successfully treat spinal stenosis and keep you away from surgery. Now, how do you find a stretch mobility coach? The Stretch Method Training Program is currently training coaches across the U.S. And our current listing of apprentices and certified coaches are going to be found at thestretchmobilitycoach.com/find a coach. Now, if we don't have a coach near you, you can request a coach in your area. We have a lot of PTAs that are looking to go into this program right now so that we can help people stay away from surgery long term. If you have any questions about spinal stenosis, please put those questions below, and one of our experts will be sure to answer you. Thanks so much, and I hope that you found this information helpful.